I've spent the last decade working in some of the highest rated restaurants in the world, cities like Paris, Chicago, and New York. I had the pleasure to cook at a very high level every day, to develop recipes, dishes, and menus. In the last few years, I was able to lead a kitchen and teach young, aspiring cooks everything I learned. But then COVID-19 came along. The COVID pandemic changed a lot in our daily lives. In the early months of the pandemic, many businesses were closed, did not operate physically. A lot of us worked from home, and none of us went out to eat. Many restaurants turned to takeout options and delivery services to stay open and in business. Americans spend more time eating at home and shopping in the grocery store than they had in decades. Now, for 2 years after the pandemic began, we're sliding back into our old habits. Restaurants are busier than ever, and the myriad delivery and takeout businesses that gained popularity during the lockdowns are still going strong. Americans are dining out more today than they did pre-2020 and are getting takeout and delivery more than they ever have before. But that means we're buying less groceries and preparing food at home less than we have also. What does that mean? What does that cost us, and how does it cost us? I want to tell you today about how giving all of the apps a rest and getting more familiar with your cutting board and your stove can improve your life. I want to motivate all of you to improve your physical health, your financial health, and your socio-psychological health in one simple way: by cooking more at home. When was the last time anyone looked at themselves in the mirror and thought, wow, I'm looking really good. I just need to keep doing what I'm doing? If that's you, then congratulations, because most of us could see room for improvement. The father of medicine, ancient Greek Hippocrates, said about 2,500 years ago, "Let thy food be thy medicine." And in a study conducted by Cambridge University, the research team surveyed local households and found that individuals who cooked at home at least 4 times per week were able to reduce their overeating, have a more nutritious diet, and even lose weight and prevent weight gain. Those who cooked at home 6 or more times per week had even better outcomes. A lot of this is because, as the study found, most food prepared outside the home had way more calories than the diners needed or wanted. Cooking basic and nutritious whole foods at home using normal serving sizes can improve your nutrition, help you lose weight, and keep it off. Many of the maladies and diseases that plague Americans and our lifespans today have the same root cause: being overweight. The CDC data for the past year shows us that about 1/3 of Americans today die from things that can easily be attributed to a poor diet, such as heart disease, stroke, and diabetes. Okay, so cooking can make us healthier, slimmer, and maybe live longer, but it can be a lot of work. But what if it could also save you thousands of dollars every year? Let me tell you from experience that if you're looking for a bargain at lunchtime, you're not going to be getting it from a restaurant. The costs of operating a business in the greater New York City area force most operators to purchase the lowest quality product they can find, market it as the best using tricky slogans or language, and then charge you 4 to 5 times what they paid for it. Even one of the popular meal kit services will charge roughly 3 times what it would cost you to just go to the grocery store and buy the ingredients yourself. An article written by Priceonomics for Forbes magazine in 2018 found that many dishes that local restaurants charge $20 to $30 for could be prepared at home for less than $4. Let's look at what that can grow into over a year. In 2019, Business Insider magazine conducted an analysis of data from the U.S. Bureau of Economic Analysis to see what Americans spend on food outside the home versus their grocery bill. In the state of New Jersey, the average individual spent $2,351 a year on takeout and dining out. That amount of money only got them an average of 2 to 4 meals per week, with an average price of $15.08 per meal. Let's assume we all eat 3 meals per day, every day of the week. So how much do we pay for the other 18 meals we had that week? Only $3,433 per year at the grocery store. That's an average price of just $3.67 per meal. So in New Jersey, if you get takeout or go out to eat, you're spending on average about $12 more each meal than if you'd cooked it at home. Okay, so we can also save that money we pay the restaurant. We could also be healthier and thinner. But could that part help our wallet? The Stop Obesity Alliance at the George Washington University School of Public Health and Health Services calculated that the average cost incurred by an individual for being obese is over $4,000 a year. Some of these costs are shouldered by industries and businesses through disability payments and lost productivity. Another part of it is paid through our tax dollars that are spent on treatment initiatives, combat obesity, insurance programs like Medicare and Medicaid. But the majority of that cost comes from the individual in medical costs and lost wages. They determine that in annual medical costs, an obese person pays about 15 times what the average individual in a healthy weight range would pay. All of these expenses must add a lot of stress. You think cooking at home could improve mental health as well? A systematic review published in the Journal of Health, Education, and Behavior in 2017 looked at the data from 11 different studies about cooking at home and determined that across all of them, participants who cooked more at home had improvements in their confidence, self-esteem, mood, and socialization. Other benefits included increased independence and well-being in teens and young adults who felt more confident about taking care of themselves and their own future after learning some basic culinary skills. Households that increased the amount that they cooked at home by just 2 meals per week saw a strong self-reported increase in family time and bonding. Those who took up cooking at home reported improved mental health, well-being, and stronger feelings of self-reliance. Cooking together is also great for families with young children. The Academy of Nutrition and Dietetics states that family meals don't just mean better nutrition. Children of families who regularly eat together also are more likely to have higher intakes of fruits and vegetables and have a healthy weight and are less likely to have behavior problems or use drugs, cigarettes, or alcohol when they get older. Plus, they're closer to their parents. But you don't have to be a chef with 3 Michelin stars to make a delicious and nutritious meal at home. And it's a great and enjoyable skill that will benefit your life in many ways. By cooking at home just a few more times per week, you can have a healthier body, a fuller wallet, better relationships with those in your household, more confidence, and a better mood state. Cooking takes time, but it doesn't need to take more time than waiting for a takeout order or sitting in a restaurant waiting for the food to be ready and delivered to your table. By prepping meals ahead of time or cooking larger quantities and then reheating throughout the week, you can save yourself time in the long run as well. Just try this one simple experiment. Swap 1 hour of screen time for 1 hour in the kitchen. This is a great simple way to improve family bonding time and mental health, especially for kids. In 1 iPad-less hour, children can learn social skills with their peers or family, learn about food, nutrition, and cooking. They can also begin to form good habits that can positively impact their health and their wealth.